What was the impact of Hurricane Ike on the University of Texas Medical Branch in 2008?
When Hurricane Ike made landfall, it was essentially a total destruction of the campus infrastructure. The institution was unable to operate for over 90 days. Being a level 1 trauma center in the region, one of only 3, it had a tremendous impact on the healthcare of the community, especially being a no-cost healthcare provider in the region. It had a tremendous and oversized impact on the indigent community. So there was quite the shakeup for the institution, and even now, 9 years later, it took us 9 years just to get to restore services.
And what actions did the university put in place to solve the heat and electricity issues?
Well, after Hurricane Ike made landfall, there was a paradigm shift in the institution, and a lot more emphasis was put on resiliency. They developed a 3-step plan, which was to raise their utilities, protect in place up to a certain elevation of 20 feet above sea level, and then also to implement on-site power generation, which the final option that was decided on was combined heat and power.
And what happened later with the Hurricane Harvey?
Hurricane Harvey was a different scenario than Hurricane Ike, where it was a flooding event. When Hurricane Ike hit, made landfall as a Category 2 storm, it still brought Cat 5 surge levels up to 18 feet above main sea level. And Hurricane Harvey, when it reached Galveston, it didn't bring the storm surge. It just brought a tremendous amount of rain to the institution, which the decisions that were made and the systems that were put in place performed. The institution kept operating. The hospital continued to receive patients and serve the research facilities to maintain their activities. They sent the students home and the administrative staff home for the event, but they weathered the storm for Hurricane Harvey.
So the role of CHP was important in this case.
Most definitely, it is the cornerstone to their resilience plan. They are able to operate in island mode and provide the utilities, the thermal utilities for cooling and heating that they need to keep the institution up and running from a healthcare and a research standpoint.